This episode is brought to you by D2C Design, your growth partner for high-performance e-commerce. If you're wondering what's holding back your Shopify store, D2C Design offers a free consultative conversion block report. That's right, no strings attached. Just contact them, set up a free call, and they'll break down exactly what your site needs. Again, D2C Design. All right, my next guest is a past guest on our podcast, Dr. De La Hoz from Neomedicine. How you doing, brother?
I'm doing great, man. Thank you for having me again. I think it's been a while, so I was very excited to come back. A lot has happened since the last time that I was here. It's great to be back, man.
Yeah, a lot's happened, and I was excited about this. So, first of all, we're in your stem cell bank or stem cell lab, and you're the first guy a couple of years ago who recommended me to store my stem cell. First of all, why should somebody store stems?
Sure. And we'll start with why stem cells are important.
Yeah.
Stem cells are the building blocks of our body. That means that these are cells that are very privileged. They have the capacity to restore and regenerate tissue and help us build muscle or any sort of tissue that is damaged. As we age, these cells also age, and the quality and the quantity of these cells decreases significantly. We see a huge decrease after 65, for example. So storing these cells makes a lot of sense because we're not storing only cells, we're storing time for the patient. We're storing the best quality of cells possible that they can have access in the future when not only the technologies that we have available right now, but the ones that we're going to have available in the future, they're going to have access to those technologies.
How young should somebody start storing their cells?
Well, the earlier the better. We have a lot of patients that have their kids, and when their kids are born, they store their stem cells, cord tissue, cord blood. That's the best. But for you and me, we didn't have that possibility, unfortunately, right?
Right.
That was something that happened after our time. So for us, the younger the better. Like I would say in their 20s, athletes, we have a lot of athletes that have stored tissue with us and cells. And these are patients that are going to use these cells. The question is not if they will use it, but when they will use it. They're more prone to injuries, and we're using them tremendously. So these patients early on their career, they store their stem cells and they have them available for any type of injury that they sustain.
Best place to take those stem cells from?
Sure. The best source is either bone marrow or adipose fat tissue. Those are the two best sources. We also have a protocol for blood, peripheral blood, which is very good because we can concentrate them, and eventually we're going to be able to do something called culture expansion. We're not there yet, but this is coming in a year from now. And that allows us to, if you have a few million cells, we can just basically culture them, expand them. And from that few million, we can do hundreds of millions to billions of cells.
So all you're literally doing is just taking some fat or blood and I can store it. That's it. It's as simple as process like that.
It's a simple process. It's a 15-minute procedure in office, not really painful. We do it awake on some patients. My partners have done it awake.
Yeah.
But we offer sedation for the majority of patients, go to sleep, like doing colonoscopy, something like that.
Yeah, it's a simple little process.
Yeah, it's 15 minutes, that's it.
Why are you opening the stem bank now? What made you drive to do this?
Well, we believe that our biologics are going to determine treatments in the future. Are going to be the cornerstone of medicine in the future. So we're just trying to lead medicine that way. And we truly believe that in the future, your own biologics, your own cells are going to determine the treatments. So why not have those cells safe right now? We know that that's the way medicine is moving, and more of a personalized care and medicine. So we are the frontier of that. And we're very excited to be pushing it.
Tell me about the future. What do you think 10 years from now I'm doing with my stem cells?
We're going to be able to regenerate tissue. We're already editing genes and doing all these things with genes. But in the future, we're going to be able to restore tissue, organs, any muscle injuries, people that need a menisci, people that need muscles, people that need tendons, ligaments, all these things. We're going to be able to use those stem cells, put them on a lab, on an scaffold, grow them, and then once it's ready, implant them in patients.
And the best part is if you get a kidney transplant now, you're getting it from a donor. You're going to generate your own kidney, regenerate, and it's probably brand new, like you were a kid.
Brand new because those cells are young, and we have the capacity also to regress age on some of these cells. There's certain techniques nowadays where we can make these cells reprogram, basically. We can make them less specialized, younger, and then from there we can make them become stem cells and make a specialized tissue again. So this is, it sounds like science fiction, but just like a lot of things, but this is going to be a reality in the next 20 to 30 years, I want to say.
Stem cell medicine here in the US versus offshore, because I've heard some progressions offshore, and whether it's an ethical issue or whatever it is. Talk to me, what are the differences?
The difference is that there's less regulation, and that can be good or bad.
Right.
Good because a lot of times that pushes the science and that allows us to do more studies, more things freely, without the oversight or the restrictions that we have here. The negative side is that a lot of times you don't know the sources of those stem cells. You don't know the purity, the quality. You don't know if what they're telling you is true or not. There's not an entity or a governing body that is really seeing that these are good manufacturing practices in place, like all these things. Yeah. And there's been a lot of cases of some nasty infections that have happened. Patients going to Mexico and then they get a really nasty infection and then they come back. There's really no way of going back there and saying, hey, you guys did this wrong, and informing other patients. So all those things, and then they have to deal with the consequences, IV antibiotics for months. Yeah. Really, really things that I have seen or we have seen that are not really the best practices out there. But again, on the other side, they're able to do some other things, which is culture expansion and some other applications for. Here we have a limitation of using it for orthopedic applications, pain management, and wound care. Yeah. And they're more free to use on neurodegenerative conditions and just cardiomyopathy, so cardiovascular disease, COPD, so more broad use.
The guys who do it right offshore, what are some of the things that you've seen that has worked? Like really progressive?
I've seen guys with severe cardiovascular disease that had stem cells injected in the heart and they had significant improvement.
Really?
Patients with neurodegenerative diseases that have been halted. Not completely reversed or anything like that, but they have slowed the progression. Right now, Mayo Clinic is doing a very promising study by expanding these cells for patients with paralysis, and it's showing very promising results. Wow. So we understand that the power is in the amount, how many stem cells we deliver a lot of times. Uh-huh. And that's something that we're going to be able to do in a year from now when we're working on some accreditations like GMP practices, AATB, and FDA certification, but we need a year to do that. But once we do that as a lab here in the US, we're going to be able to do pretty much what they're doing in other countries. Also, Florida just passed a law that is called the stem cell law, where we can do non-FDA approved stem cell procedures, and we're the only state that can do that. And that opens the door to do other procedures that the FDA hasn't approved, but we know that they have a lot of benefit. Now, we're going to have the oversight of the FDA because we're going to be registered and all that stuff, and we're going to be governed by all these entities, so we're going to do things the right way. Yeah. But we know from publications and studies that have been made that this is the right way to go.
Tell me what you're doing here at the lab. Why the lab? What do you do here?
So here we store cells for the future, basically. But we not only do that, again, we're buying time for patients. We're storing time. We're giving the possibility to have access to future therapies, and not only future, but now. And we give them that capacity. Why? Because, again, we believe that the biologics are going to be the future. We truly believe in that, and we're already seeing that in personalized medicine. We're also able to use these cells to drive a lot of research, which we're doing. So we're doing research with stem cells. We're doing research in longevity. And that's what allows us to have these stored tissues here. We can partner with industry leaders, AI companies to train models to see which ones are going to be the best type of stem cells or the best treatments, the best quantity. So we're able to generate all this data, and data is power, as you know, right now. So that's why we have it. So not only as a business, it makes sense because it's a very scalable business, and we're creating these hubs and partnerships with different clinics across the country that, again, eventually we can generate all this data and really drive science with evidence, real world evidence. That's what we're creating here.
It seems, last time you were on the show, I think I said one of the issues with the area of medicine that you're going after is an educational for everybody. Fast forward, you were on the show a year and a half ago. One of the things I've seen coming specifically, and I'm very excited about it, out of DC, is just an education of, we all know that the healthcare system, and it's not healthcare, it's sick care, but B is like, look at all the things that you're putting into your body, from pesticides to dyes to, what have you. Talk to me about the future that you're seeing from regulation, DC, into your world and into your corner of the medicine.
Well, hopefully
profession.
now that we have more conscious about it and we have the public better understanding what we are exposed, hopefully that can help us drive more policies that are towards protecting the consumer and helping the patients out there. So we're hoping to see a big push for more of these stem cell therapies and more changes in healthcare that are going to drive more biologics, more of the natural approach to medicine, bringing medicine back to what it was before, where it really worked better. Less pharmaceutical control, less of this influence, and more of the real evidence that works, and natural is always going to be better. Like all these type of things. So this is what we're hoping to see. I think educating the public is essential for this to happen. And that's going to drive a lot of the policies that we're going to be seeing in the future. But we're very hopeful. That's what I really see.
Yeah, the education. It's funny because all the old school, and you call it bro science stuff that people used to make fun of you, now is all true. Lift weights, where you source your food, stretching. You and I were talking about hanging, like a simple hang. It's had a major impact on me. Sauna, ice therapy. It's crazy. What's a misconception that people have about stem cell and stem cell therapy?
One, that they don't work. That's all science. Yeah. And I think, there's good and bad players in every industry, and they all contribute in some sort of way. But I think that perception that they don't work, that has been debunked completely. We have plenty of data. We have plenty of studies, very conclusive studies that it works. Especially with what we're doing here, which is focus on musculoskeletal conditions, orthopedic pain management, and wound care. I think that's the biggest one. And two, that is super expensive, that nobody can access that.
So that's what the second question I was going to ask you. So you're an entrepreneurial guy. I wanted to talk about the business side. Talk to me about therapy, because one of the big surprises for me, it's actually not crazy expensive, specifically if you have, a high deductible plan that they're going to get you on some kind of medication or physical therapy that you're never going to get off of, like whatever. Like, walk me through sort of just the business of it.
Yeah, the business, again, we try to make it as affordable as possible, and having a bank allows us to do that. Why? Because we don't have to do blood draws or extractions every time.
Right.
That decreases the cost for the patient tremendously immediately. So you have to store samples. That's going to cost you a yearly fee that is very affordable. And we're talking about $350 a year. Like, we can say
I just got my bill. It's not a lot.
It's not a lot.
It's not a lot.
Anybody can pay that. Again, when you understand that this is just you're banking on your future. Right. So this is insurance, just like we all have. So that decreases the cost. Having this structure decreases the cost significantly, not only for the doctors doing it, but also for the patient. And we can translate those costs to the patient. Doing it here, people believe that going to Panama or going to Mexico is going to be cheaper. It's not true. Here, we can do it cheaper a lot of times. It depends. Again, it depends on a lot of the details, but it's not going to be that expensive. And we can still be very lucrative. And we're doing conscious capitalism. We're doing something that is good for the patient.
Correct.
Offering a very good therapy that is natural, that they're not going to have any side effects, that it's going to work. And at the same time, we're being lucrative. So I think it's a great model. It's very scalable. We're storing, so the more patients that we have stored, the better it is for everybody. We can decrease those costs of the patients ultimately, and we can also grow the business and scale it. So,
yeah, I mean, one of the things I do like about the business is that it doesn't take up a lot of space to store stuff. So how much can you store? And for the folks at home, we're in a room that's maybe 2,000 square feet. Yeah. And by the way, he's only using probably 600 square feet to do the storage. What are the unit economics, and what does that look like?
So as you mentioned, it's not really expensive. Yeah, the startup.
The infrastructure is.
The infrastructure is, all the machinery that we have. I mean, we have sequencing machines and all these things because we want to do some pretty cutting edge stuff in the future. We have a clean room. We have all these processes because we're dealing with obviously tissues and infection and all these things, quality control. So those things, putting them in place is, obviously is costly. But after that, the operation, we have one technician that is really mainly one of the only employees that we have. We have the other employees are on the operation side. And in terms of the storing tissue, the only thing that if we run out of space, we can add another cryogenic tank. And as we scale up, we buy another cryogenic tank and we are more cryogenic tank, but we don't really need a lot of space for these. No?
Yeah, so the capex isn't crazy. The maintenance, you got to kind of a clean room, obviously cooling. I mean, it's nice and cool.
Right, insurance, all these things. Obviously, backup systems. There's some things, but again, is it doable? Yes.
Heavy out of pocket for the patient. The insurance companies don't want to cover this stuff because it's sick care, right? The sooner you get better, you're off the.
You don't need that insurance anymore.
You don't need that insurance anymore. Are you doing just it's called direct to consumer, or are you doing B2B work here too? You're doing a back office for other.
Yeah, we have a flexible model, and that's the beauty of it. We can target the patients that are health conscious and worried on longevity, and that's kind of like the bread and butter for us. But we also partner with clinics that are offering these services to their patients, and we have clinics in Texas right now that are offering the same services, and we have couriers where we can send those samples, and we have them here overnight. I mean, they can be preserved, and then we process them minimally, store them. That's it. So the idea is to expand and again create hubs all across the country.
Yeah.
These samples can be sent to us directly. It's very easy. And then with that, again, we can create all these nationwide research. And not only that, with data, we can de-identify these samples and attach them to patient medical records. And we can really monetize a lot of the data and the information that we can get, develop new biomarkers, so new technology, new therapies, test things and see what is working and what's not. So honestly, there's so many
and it's very scalable. I mean, it's scalable, right? So you're right. It's not crazy capex. You don't need a lot of people, and real estate, wonderful. Most business people love to hear that. Right. But the way I look at it is like just the addressable market is everybody, right? And I still think, and we're getting there, is the education, right? They're like, what is this? And is it, bro science, or is it something real? And you're seeing it now as the media just sort of breaks up, right? The mothership of mass media. And you're getting all these just different, very smart, talented people talking about it. And more people listen to them and don't tune into Fox or CNN. And they're starting to understand, wait a minute, that path that people used to have that I have to be on, what was a stat that I read the other, people after the age of 60 are like hooked on at least 2 or 3 drugs for the rest of their life. I'm like, man, this just doesn't jive with me. Like the answer is no. Yeah, and I think people are getting sick of it and the cost and they're seeing the side effects.
Completely unconscious, and that's not the way to live either. It's just like, so you're masking the symptoms. Why not work on prevention? And that's where we're switching in medicine. Prevention and doing this type of biological therapies and having access to them is really going to help us improve our quality of life when we reach that later stage in life. We're going to prevent injuries. We're going to be more mobile. We're going to be able to, again, eventually regenerate and repair tissue.
Correct.
So we're seeing that a lot of patients, unfortunately, they need joint replacements early on.
Yeah.
And they're looking at revisions and all these things that it's really painful, not only painful, but debilitating.
And you're going through that at an old age. So, you don't want to get a knee replacement at 75. Like, you're not going to recover like when you were 35. That's what
completely. Now we have this capacity to prevent those injuries. And then, if early in life you had a meniscal tear or you had a ligament tear, we can target it, we can repair it, we can prevent the progression of osteoarthritis before it gets to a stage that is just too late. So we're able to do all those things. Also, with the other therapies that we're developing in conjunction, like hormone optimization and peptides and all these things that now we know that they're wonderful. We're targeting aging in a more holistic approach, and the reality is that we're going to be living longer, and we already are, and we're going to be living a healthier life in the later years.
In the later years, that's what I tell people. Like the 80-year-old that your grandparents or 80, 90, whatever, if they made it that far, is going to be very different than the modern day. By the way, it's not just all this stuff. You got to take care of yourself. Where you source your food, you got to work out, stretch, all that kind of stuff. But you can live a pretty active life. Like,
it's multifactorial again. But if we introduce all these things, healthy diet and exercise, sleep, all these things, and now we have all these monitors and ways of tracking everything and adjusting. So for us, we have a lot of patients that use wearables, and we can track all that information and we can make modifications. So that's on the longevity side, because we've been focusing on talking about stem cells, but we do all these other therapies in terms of longevity, like hormone optimization. We know that hormones are essential for aging or anti-aging. So adding that, weight management, prevention, diet, all these things, adding all these things, we're seeing that patients are doing a lot better, and we're able to prevent patients from taking medications. And we're getting patients off medications. That's a reality. I had patients that we've been able to take off statins. We've been able to take off, high blood pressure medications, diabetes medications, just by modifying all these things. So it's not a myth, it's a reality. We've seen it. And hopefully with everything that we're doing, again, in the biobank, we can store samples and we can not only say this in an anecdotal way, even though we're doing large-scale studies, but we can gather more data that really is going to help us quantify these and generate data that is very robust.
It's funny because you said hormone therapy. Like one of the things I recently read, and you know the stat probably better, like sperm count in men has crashed. Why?
Well, we're exposed to all this peptidized diet is crap. We're not moving, we're staying home. Like all these things have a huge impact on that. So one of the things that we're doing here also, because we see so many patients for hormone optimization, and we see younger patients maybe in their 30s that they want to get into hormone optimization, hormone replacement, and they're still worried about reproduction.
Right.
Guys that are in their 40s, maybe they already had kids, but they don't want to give up that. Maybe they remarried and now and they're thinking about having kids again, but they have been on testosterone. So one of the things that we're offering, because we are on the cryogenic space, is quantifying sperm counts and also storing sperm. It's pretty much similar protocols, storing sperm. And the younger that you do it, the better, because of what you're mentioning, because the count and also the exposure to all these different factors that are going to impact the sperm.
Yeah.
So not only we can do that, but by doing counts early on, we can also optimize that sperm. We can put patients on protocols to optimize the sperm. Mm-hmm. And before we thought that, that's that's women problem. Reproduction, no, I'm a guy. I'm fine, It's not anymore. We're seeing more and more men that are not able to procreate and have kids because the quality of the sperm is not there.
Right.
So one of the partners that we have, he's a urologist. Mm-hmm. So we're really looking into finding solutions for that space. And again, with all these things that we're seeing, I think it's a great thing. And we need to make it more mainstream. And we need to normalize, hey, I want to get my sperm count. Yeah. I want to check my sperm. I want to see how I am. I think the earlier that we do that, and it's just a regular check, it's easy to do, the better information that we're going to have and the better that we're going to be able to treat patients, prevent from getting into a place where, hey, it's more difficult. So I think, again, not only on the business side, but also looking at helping patients, it's going to be a tremendous opportunity for us.
In the next 5 years, how big, from a business standpoint, do you think this industry is?
It's going to continue growing. Again, right now we are looking into integrating many clinics around the country. We have a project in Colombia for stem cells, for manufacturing some of these stem cells, basically. So we have two types of stem cells, and I have to talk about these. Yeah. Ones that are from you, which are always going to be the best. They're called autologous, and then there's allogenic, which is from a different source. So in Colombia, we're working about doing these allogenic stem cells from fetal tissues, and that's one of the projects that we have. But in the next 5 years, obviously, integrating many clinics, doing more studies, integrating AI, developing therapies, the culture expansion, what I told you. So just growing in the stem cell space, not only in the stem cell space, but also in the data space, collecting more data, just getting more partners, basically.
And the stem cell business has been taken out of the hospitals, right? Are just hospitals they're not entrepreneurial, they're owned all by private equity now. Yeah. And they're just not going to be cutting edge. They're sick care and emergency care, and then just elderly, your last life, and
the way that it operates is just so difficult to get through these committees and IRBs and approvals. We have an IRB that we work with outside, and this is basically an entity that allows us to approve protocols and to oversee everything that we're doing, and also clinical studies. We're able to move faster, And when we have private investment, things tend to move a lot faster.
Of course, right? They want to return. Right.
So we're able to do all these things. So we're really looking into this. We have a lot of interest right now. We're raising a lot of capital. Yeah. So we're very excited. It's just a good time.
It's a good time. Give me your prediction. First of all, I will take great joy if healthcare got shaken and disrupted like crazy. Multi-trillion-dollar industry, it needs to be broken, okay? Give me your predictions the next couple of years. What happens in healthcare and specifically around the people that I hate the most, which is the insurance folks.
Well, I don't. In the next few years, I hope again that we continue the trend that we are in right now, which is very promising, and that is changing policies little by little, changing policies and changing the perception of the consumer out there or the patient, where we need to understand that hey, we don't really need insurances as much as we think that we need them.
Especially 100%.
Especially the younger that we are.
Yeah.
And we need to do a better job educating the younger population and saying, hey, you don't need that insurance that is charging you all that money.
Yeah.
Go with a minimal insurance for emergencies, and then the rest, you don't need it because, well, you're being covered for emergencies, and that's most of the times why you're going to be using the insurance. So use a lower deductible, get an HSA account, a health savings account, save all that money, put it there, and then any expenses that you need out of pocket, you can pay. Go to the doctor visit.
It's before taxes, so it's easy.
That education, focusing on good nutrition, exercise, continuing on this trend, again, and showing insurances that, hey, we don't really need you.
Yeah.
You need us more than we need you.
Correct.
And that is going to force them to change that model.
Yeah.
I think we need to put more pressure as a patient or as a consumer on insurances and really not take what they give us as a whole truth.
Yeah.
We need to question everything that they're telling us. No? And the more that we do that and the more resistance that we put them, I think that's going to put them on the spot where they understand that they need to change their current policies because they're not being fair with us.
And they're not being fair with the doctors and the nurses because you go to any doctor's office, it's really just a back office of them figuring out the billing and who's going to pay for what. I remember shocking once, I went to a doctor, I had to get an MRI, and he comes in and he goes, for this kind of MRI, insurance companies typically don't. They're going to fight you. So I'm just going to have to tell them something else. I'm going to go, wait a minute. This doctor's trying to do right by the patient, and I appreciate it. But he's going to have to lie in order for this. And I wasn't super injured, but I had to get a thing done. I'm like, man, that puts him in a bad spot.
Completely.
Like, why is it this difficult?
And unfortunately, we have to do that as providers, as doctors, to be able to help the patient. The big enemy, and I'm going to say it straight up, is Big Pharma, unfortunately.
Of course.
They don't want to prove this. They don't want to help us. And we're not asking for things that are not necessary. We're asking for things and tools, studies that we need in order to help the patient. So again, the more resistance that we put as a consumer, I think that's going to generate and lead us to change these policies and for Big Pharma to really get shaken up and wake up and say, well, we need to do something about it and change.
Good stuff. Where can people find out about you?
So Prodigy Cells is the stem cell bank, but mainly our clinic, the Neomedicine Institute. We're in Doral and in Aventura, Florida, but we treat patients nationwide and all over Latin America. They can go to our website, neomedicineinstitute.com. Our social media, you can find us on Instagram.
You're very active.
Neomedicine Institute, we're constantly talking about stem cells, longevity, anti-aging, and all these things. Any questions, contact us. We're always happy to hear from patients, possible patients, or any questions that anybody can have, because the main focus of what we're doing here is educating the public. Even if you don't come to me, I want you to make the best decision. I want you to understand the science behind it and if this is the right treatment for you.
Good stuff. Thanks for doing this.
Thank you for inviting me. I look forward to hearing from your audience, and we should do these again in the next year to see where we are.
How many of these you have?
Exactly. Well, hopefully, man. Thank you.
Yeah, man. Well, so enjoy the show. And for anybody listening, we're going to do a small outtake on YouTube. So you can check behind the scenes with Dr. Carlos and enjoy the show. Thanks for doing this, man.
Thank you, guys. Thank you.
Once again, I want to thank our sponsors, D2C Design, your design firm for anything related to Shopify, e-commerce, and your website needs. Again, you can find them at d2cdesign.com. Thanks.